Hello, I'm Dr. Thierry Hertoghe. I'm president of several societies like the World Society of Anti-Aging Medicine, which is probably the greatest society in the sector. It has more than 6,500 physicians. And I'm also president of the International Hormone Society, which is a society of more than 2,250 physicians from all over the world. And I have a practice, and in my practice what I do is I do a sort of global consultation where we screen the hormone deficiencies of a person or eventually hormone excesses. We screen also all the nutrients they may be deficient in, and we see some classical lab tests like the sugar level, the cholesterol, and if there's more prostate cancer or other cancers risk. So we try to do a thorough job, and when we have the lab test, we also do a good screening physically. We examine the patient. We take about an hour and a quarter to an hour and a quarter with each patient. I come in the consultation. I'm not always 100% there, so I take just part of the time in the consultation. But it really is something that is worth doing, and I love my practice because we can also help very difficult cases by taking a lot of time with our patients. But we have changed our practice also in the sense that we have shorter consultations or are more specific on topics. We have, for instance, a sexuality consultation for men and women, where we screen also for men the erectile dysfunction, what type they have, because it's always a different treatment. There are different hormones that may have to be applied, or different other treatments, because it's not always over hormones. There's sometimes people even don't have enough body scent, so you can even give pheromones that give a better body scent. And I think it's one of the farthest sexuality consultations you can have in that type, at least. We also have a nutritional therapy consultation where we screen all the different vitamins, trace minerals a person can be deficient, and I've even screened the best products I could find here in the market in Europe, in the sense that even the capsules, we see if it's vegetarian capsules, there's no animal product in it, there's no additives that is bad, there's not a titanium oxide, for instance, that is maybe a toxic, it's a suspected substance that may not be good for the arteries, and so we try to make it safe. That you also have ecological packages, because I think it's very important, and to try to treat the whole person, not just looking at the lab test, but also checking if the food is good. I always pretend, and I'm sure I'm right on this, is that the food is the first medication. How can you help a person if the food is too bad? You should have either food rich in vegetables, fruits, and with low sugar index, and meat that is cooked at low temperature, but not take all what is called the junk food. You may take it from time to time, but not too much. So we do this. In our consultation, we also have a special consultation to see if you have certain expression of genes, genetic consultation, and if you have some predisposition to disease based on your genes, we can do something about it. We have a sort of nutritional approach where I have screened all the different studies that make it clearer for us to know exactly what vitamin or what nutrient will really help you to really decrease your risk on the long term. So I think these sort of consultations are very interesting. We have also some very shorter consultations. Very short is 30 to 40 minutes consultation, where we only screen the lack of sex hormones or the lack of thyroid hormones. So there is enough to help the patient improve as good as possible. Thank you for your attention.